Welcome back to our channel. We are two actually practicing doctors, but we've taken out the white coats and we're here just to have real talk with all of you about some of the most Googled health terms. So make sure you subscribe, hit the bell wherever it is, comment, share, and tell us what topics you want us to have real talk with you about. Today we're chatting about a topic I wish we didn't have to discuss, and that's substance abuse, substance use disorder. Quick show of hands, and you can participate also. Who in here, and I'm including our production staff, knows someone who has suffered from substance use disorder?
Me.
Literally every hand went up, because guess what? It is a very prevalent problem. 90,000 people in 2020 died from overdoses. That was just 1 year. That's not even including everyone out there who is addicted right now. So guess what? This is a topic that we gotta chat about because addiction, substance use disorder can affect anyone, white, black, brown, yellow, rich, poor, young, old, all of it. So after this video, you will hopefully have a better sense of what a substance is, what substance use disorder looks like, what you can do about it, and you'll just be that much more knowledgeable for yourself, for everyone around you.
And we hope that you understand the top signs of substance abuse disorder.
We really hope that, Jamie. Thank you for adding that in.
All right, so let's dive into the 8 things to know about substance abuse, substance use disorder, including tips for identifying signs of substance abuse.
Because we all play a part.
So number 1, what is a substance? Well, a substance is alcohol or any other molecule that alters your physical or mental state. I mean, it can be heroin, it can be coffee, it can be really anything that you are going to ingest or inject.
Like coffee, which a lot of people take every single day. I've had 3 cups of coffee today. How many cups have you had?
I've had 2 teas and 1 coffee.
There is caffeine in tea, which is the mind-altering substance.
That's probably is what it is.
That's it. So that's why some people out there like don't want anything touching their mind. They won't even touch coffee. But my point is that there's a lot of substances out there. So what exactly is substance use disorder? Mental health professionals, clinicians use something called the Diagnostic and Statistical Manual of Mental Disorders to basically classify all these mental illnesses. And they now refer to substance abuse, substance addiction as substance use disorder because it's a more encompassing term to basically say like, hey, this is a diagnosable illness, and to try to eliminate the stigma away from it so that people actually feel open about potential addiction, use disorder, and to actually have that dialogue going. And here are some of the questions that a clinician may ask somebody that I'm going to now ask Jamie right now.
Here we go again.
This is how we characterize substance use disorder. There's multiple criteria like, are you using more of a substance than you should?
Yes.
You're trying to cut back, but you can't.
Hell yes.
Do you have cravings, tolerance, and withdrawal?
Maybe.
You spending more time progressively trying to get that substance.
Oh yeah.
Remember, this could be marijuana, tobacco, alcohol, crack, opioids, a lot of different things out there.
Or according to a loc, it could be my tea.
If your tea was spiked with something in it, it could be ayahuasca tea. Hey, are you neglecting responsibilities?
Yes.
Relationship problems.
Oh yeah.
Giving up social priorities, trying to use your substance.
Yes.
What substance are you referring to right now?
Tea.
Okay. Putting yourself in danger to get this tea.
No.
Okay, so you'll have relationship problems, neglect responsibilities, spend more time trying to get your tea, but you won't put yourself in danger to get it.
No, because I Uber eat it.
Okay. So you put someone else in danger to get it. Are you continuing to use a substance even though you know it's bad for your health?
I got it right here.
Okay. So basically, these are the set of questions that physicians or clinicians or mental health professional would ask about substance use. And take a second, think about all those questions we just rattled off if you have a question about substance use. If you had 1 that you said yes to, you're at risk. 2 to 3, mild substance use disorder. 4 to 5, moderate. 6 or more, and you may have a severe substance use disorder. And that's how you diagnose it.
What do you have?
Number 2, what are the top 10 substances people are abusing? Dr. Rutland, it is trivia time.
Okay.
Can you tell me in order,
Ooh.
from most abused to least abused, what the top 10 substances are that people are using?
That's a great question. I'm gonna go with number 1 as alcohol, number 2 as tobacco, number 3 as marijuana, number 4 as cocaine, number 5 as opiates, number 6 as I'm all out of substances.
Okay, so listen, I gotta give Dr. Rutland props here because alcohol and tobacco are at the top. Then when we start with illicit substances, so substances that are not federally legalized, marijuana is number one. Opioids. Opioids and pain meds. Way too many of those out in the street, like oxycodone, fentanyl, morphine, absolutely killing people. That's right after marijuana. Then hallucinogens. Mushrooms,
LSD.
LSD, ecstasy. Sedatives, benzos, muscle relaxants. Then cocaine, then your party drug. Then prescription stimulants, like amphetamines, Ritalin. You have Ritalin, and Concerta, and Adderall.
Yeah.
But you actually need that. You're not abusing it.
Right.
You need some right now because like we cannot get you to stop talking about Mariah Carey and other bullshit.
That wasn't my topic.
Get the Ritalin.
Listen here. So we were having this conversation about is Mariah Carey still relevant?
Seriously?
Let us know what you think in the comments below.
This is why I made the comment about him needing to go get his stimulant medication, which he's not abusing as a prescription because he would not stop talking about Mariah Carey in between takes.
And that's the whole problem with stimulant medication is when you take it, you get focused on whatever it is you're thinking about at that time.
Which apparently was Mariah Carey. Anyway, then we have methamphetamines, then inhalants. Inhalants, things being like whippets. You know what a whippet is?
What's an inhalant?
Inhalant.
You mean an inhalant?
Oh, damn it. Inhalant? I like inhalant better. Fine, inhalant. Inhalants?
That's how you pronounce the word.
Do you know what a whippet is?
Yes.
Do people in your high school use whippets?
No, never.
Really?
I mean, I was a dork.
I'm not saying did you use whippets. I said people in your high school use whippets.
I never heard of it. All I did was play basketball and go to class.
So why do you know about whippets now?
Because I watch movies.
Okay, fair. But there are kids nowadays, I don't know, the train came back, where we are hearing about stories of kids using whippets or using things like whipped cream and getting the nitrous oxide out of it, passing out. I swear to God. This list was only the top 10. There's a lot more out there. If there's any that we didn't mention that you've seen, comment below. Like K2, bath salts, spice.
Don't know much about substance abuse disorder because the only substance I abuse is air.
It was literally the dumbest shit I've ever heard. Like, I've heard some really dumb shit.
Here we go to number 3. Number 3. So what do these substances actually do to your brain? We have to think about the way the brain works. You have a bunch of nerves in your brain that communicate with other parts of the body. So what these substances actually do is they interfere with that communication. So the communication is not as smooth. It's like if you're driving on the freeway, when you're on the smooth road, everything's fine. And then all of a sudden, if you fall asleep, that's what the substances are doing to your brain.
Literally everything in our body that our brain does, which is literally everything, is controlled by these tiny little messengers called neurotransmitters. These things are what have you feeling great, or euphoria, or wanting to dance the night away if you are taking a substance. So marijuana, cocaine, methamphetamines, they all mess with these little messengers. And substance use will affect many different parts of your brain, like your basal ganglia, which helps you get that euphoric feeling, your amygdala, which makes you say like, I'm anxious and I'm irritable if I don't get my drug, your prefrontal cortex, which is all about that impulse control when you're like, I will do anything to get the substance. Even your medulla, your brainstem, the control center can be affected by something like opioids, which can literally cause you to stop breathing. Not a good thing. But here's what's awesome. Jamie gave the analogy about the highway and all the cars on it being little tiny neurotransmitters, which tell your body like, oh my God, this is great. I feel good. Which is why if you work out, you get endorphins. If you snuggle up with a loved one who's really adorable, you get endorphins. If you succeed at work, same thing. But certain drugs like cocaine and methamphetamine will give you such a rush of these neurotransmitters, they will far exceed any activity you can do, such as cuddling up with your attractive co-star. And then all of a sudden your brain gets used to it and you're like, oh my God, I want all these neurotransmitters that you got from cocaine or methamphetamine. Nothing else is gonna come close. If I don't get that, I'm gonna be pissed off, I'm gonna be in withdrawal. How do I replace that? And it doesn't matter how many cute co-stars you cuddle up next to, you want that substance.
You're never gonna replace it.
Number 4, there are societal impacts of substance abuse. It's not just about the individual. Now, substance abuse costs our country, our healthcare system, about $530 billion a year in tangible losses. But if you take into account shortened lifespans, lost productivity, and everything that happens in healthcare, some estimates put this at over $1 trillion a year from substance abuse. It affects every level of society.
If we get you guys to think about one thing in terms of substance abuse, is you have to think about your family and friends that are involved. Think about the times in which you're chasing substances instead of picking up your kid. Think about the time you are doing deals and trying to maneuver your life around to be able to get a certain substance, instead of being at home for your friends or for your family. It really does affect them to the point of them thinking about it for the rest of their own life.
It's going to affect the community, hospitals, jails. There's an increase in theft and violence and homelessness. This affects our foster system, law enforcement. This is why it is a societal responsibility to address substance abuse.
So number 5, who is at risk? Well, let's think about this. We know that there's always a genetic component to addiction. That's one of the reasons why I don't abuse substances, is because of my family history. Other individuals who are at risk of developing a substance abuse disorder are individuals who start using substances early, individuals who feel peer pressured as well. So again, peer pressure is not the greatest, especially when it comes to abusing substances. So you have to think about those things so that way society can have more of a positive effect overall on individuals instead of a negative one, essentially forcing them to abuse substances.
Other risk factors include taking a highly addictive drug like crack, or even a history of other mental illness, which can cause an increased risk of being addicted to substances. So if you take a look at all these variables, you can tell substance abuse doesn't discriminate. It can affect anyone. Number 6, what does treatment for substance use disorder look like? It could be a combination of medications, detoxification programs, behavioral therapy. There might be an individual plan that a physician, psychiatrist, psychologist. There's even 12-step plans that can be used not only for substance use disorder, but any addiction, whether it be gambling, sex addiction, shopping, whatever you individually need, there's a plan for it.
It's important for you to stay out of those risky scenarios once you've accomplished that plan. You don't want to put yourself in a position of relapse. That's one of the most important things. If you put yourself in that position of relapse, you may fall back on that wagon and you may get started with that substance again.
And of course, one of the most important things that you can do is to ask for help immediately. If not directly to a healthcare professional, to a friend, family member, or trusted colleague who can get you the help you need.
So number 7, individuals who are considered high functioning also suffer from substance abuse. So let's think about this. We're not just talking about celebrities.
Demi Moore, Eric Clapton, Elton John, Bradley Cooper, Tim
Alec
McGraw,
Baldwin.
Robert Downey Jr.
They have checked in, they have recovered, and I'm proud of that. But every single week, it seems like there's a new celebrity that has something in their system. And for me, I think it's swept under the rug. I don't think it's addressed enough. That's one of the motivations behind actually filming this episode. I think this is something that we have to talk about. This is something that needs to be destigmatized because I have watched celebrity after celebrity pass away in my ICU. Substance abuse is a big deal.
And it can affect anyone, including all these celebrities who have plenty of resources around them, even doctors and healthcare professionals who we both know. I personally know doctors who have been addicted to fentanyl, to opioids, who are alcoholics, who I know a doctor who got addicted to heroin and who's in rehab. They know the effects of it, but sometimes addiction is more powerful than your sense of judgment.
It's a real thing. And if you think you have this disorder, ask for some help.
Number 8, and possibly the most important in terms of making a difference, what are some resources for people out there to seek help or get some more information about substance use disorder? One of the best places you can go is go online and look up the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. They have a whole library of resources. You can also check in with a local community center, whether that is AA meetings or any other type of group setting where you can find therapy, or talk to a healthcare professional about what the next best steps are.
Always talk to us because I think it's important. We're listening, we're there for you. We want you to be a positive aspect of our society. So please just let us know. Again, doctors have problems, celebrities have problems, everybody has problems. We understand that and we're here to help you.
And if you don't want to talk to these resources, it's all good. Talk to a trusted individual, a friend, family member, or anyone, and they can go get you the help you need. I promise you, they are waiting and they want to actually hear from you and help.
Thanks for joining us today. Really appreciate you guys being here. Subscribe, hit that bell button, mention us in the comments, make some comments, let us know what you want to hear next. But we're here to actually provide you with the information of the top Googled medical subjects.